This is our House Calls series. I'm going to focus a lot on healthcare and really Medicare.
Medicare is extremely important in this particular race. In Pennsylvania alone, 18% of the population is on Medicare, and there are 4 close House races. This is a particularly close race, and the candidates are really going at it on Medicare. Trivedi is very aggressively hammering his opponent on this issue for having supported Ryan, and Gerlach is coming back hard with the same kinds of arguments that won him this seat easily in 2010.
This is, I think, going to be front and center. And as a physician, you know, people want to know what I want to do for healthcare. I think people trust their physician, and rightfully so, they should. And right now they don't trust politicians. And so I like to talk about my perspective as a physician. That's what I want to bring to the table in Congress, and one of the big things that I think we need to address is Medicare. The selection of Paul Ryan really brings this plan into stark relief. I've always talked about preserving and strengthening Medicare, trying to reduce costs, but keep that promise. I've talked about it in 2010, I talked about it this cycle, and now finally, because it is a national issue agenda, people are talking about this. I don't think it's going to be easy for Jim Gerlach to A, hit me with that, but B, also run away from his votes for that radical plan.
Jim Gerlach was very successful in 2010 in claiming that his opponent, Manan Trivedi, was in lockstep with President Obama and wanted to cut $500 billion out of Medicare. Since that time, the Congressional Budget Office has updated that figure to $716 billion. Well, Gerlach has told me that makes it an even easier sell to his constituents that, look, Trivedi is in lockstep. He supported cutting $716 billion out of Medicare, and that's a big deal, and he says that is really selling with his constituents.
My experience listening to the people who are on Medicare already is you just have to be scared that you're going to lose it, and I don't think they trust the Republicans. I think once they say that, once they really understand that their plan is under potential attack, that they might very well wind up with one of these vouchers that everybody knows isn't going to cover the costs.
And as a physician who treats a lot of Medicare patients, I know that's not going to work. As a guy who's studied health policy and done health services research, I know that you're going to have this death spiral, that the richer and the healthier will be okay, but the poorer and sicker will get even poorer and even sicker and won't be able to survive on that kind of premium support Medicare.
Political analysts cite about 60 races that are very competitive in the House this time around. Of those races, about 2/3 have high percentages of seniors, which makes Medicare an issue in those races.
Thank you guys so much. Thank you for listening to me and taking the time. Thank you.